It's my feel-good breakfast show.
Welcome back. You're still live with your Feel Good Breakfast Show. It is Tuesday. It's all about Health Tuesdays. And the month of March pays special attention to endometriosis awareness. We honor, we raise awareness, and we also show our support to almost 200 million women worldwide who suffer from this disease. The pain of endometriosis can have a devastating effect on the quality of life for these women.
Yeah, that is true. Now, specialist obstetrician and gynecologist Dr. Sonntag will be telling us more about the symptoms, the causes, treatment options, and of course also what else can be expected after an endometriosis diagnosis. And of course, here to tell us all about it, Dr. Sonntag. It's so good having you in studio this morning. How are you?
Good, thank you.
Talking about a topic which is surprisingly quite common, yes, Jamie?
I didn't know it was that common until it actually started affecting my friendship circle. So I have two friends that was diagnosed with endometriosis, and it's been difficult to see, you know, how they started their journey and just where they're at with regards to it. But for many people, they don't know about this. So let's start there. What exactly is endometriosis?
So endometriosis is a condition where the endometrial lining, which is the lining of the uterus, grows elsewhere. So outside of the uterus, in the abdomen, on the ovaries. So that's basically the definition of it. It can present with quite a lot of pain, painful periods, and can also be quite difficult to diagnose.
So Dr. Kim, I would imagine, obviously, answer the question of male versus female, I'd imagine, but who is more likely to then obviously get endometriosis? Are we more vulnerable to it at a certain age or not?
So there's a lot about endometriosis that we don't yet understand. It's commoner in women who haven't had children before, or those who struggle to fall pregnant, and then also in women who have a short menstrual cycle, but it can affect anyone, and it's also during your reproductive years, so from when you've started your period to before you go through menopause.
Yeah.
Because here's the thing, you know, when we have that time of the month, you're in so much pain. How do we know if it is menstrual cramps or endometriosis? What is the first sign that we need to be looking out for?
So that's a very good question, because it is difficult to tease out what is a painful period versus something abnormal. Endometriosis typically also has pain before the period. So from a few days before the period, you could have pain that lasts through the period and then afterwards as well. Also pain on urination or passing a bowel movement, pain with intercourse, and very heavy periods. So those could all be signs that you might have endometriosis.
Okay, well, you've clearly given me a bigger picture of these signs and symptoms, but what is it that causes it? I mean, is it something that women can prevent? Is there a reason for it occurring in the first place?
So the causes of endometriosis are also not very well understood. It's thought that during menstruation, some of the blood flows out through the tubes and then the lining goes into the rest of the abdomen, or that the endometrial lining can go into the abdomen during a surgery or a cesarean section, but we don't really know exactly how it happens. Women who are more likely to get it are the ones who, like I said, have a shorter cycle or quite heavy periods. But also, you know, if you start to feel like you have some of the symptoms that I've described, then you should definitely go and see a specialist.
Let's speak about that, because there's a viewer watching now and they think that they have endometriosis. What should they do? What should be the next step after they think or they believe that they have endometriosis?
I think going to see a specialist is probably the best. To see a GP is a good idea, but sometimes it might be out of their scope. So to go and see someone who deals with endometriosis, and also not to Google too much, because often you Google the symptoms and you think that you have something when you maybe don't. But if you are concerned, then to go and see a specialist.
Well, look, I mean, there's so much I'm wanting to learn now. So many questions that I'd like to ask, of course, as well. For me, it's more important, though, that we actually just speak about this, that something is what I would imagine, it seems to be the norm in a sense, in terms of we are having a lot of stories, we're hearing a lot of stories about it. Jamie's mentioning her friends. But the more important factor for me is that it becomes a conversation. And it's not like an irregular thing to speak about. We don't need to be embarrassed about it. And is it something that you notice on your end that is a conversation that's not often had enough?
Well, I think most women are quite embarrassed to talk about their periods, not with a doctor, but with, their family and friends. It's not the normal kind of thing that you bring up over dinner. So I think people will suffer in silence and not say anything about it. Meanwhile, there might be women who are experiencing exactly the same thing, but because everyone is being quite quiet about it, no one shares their story. So I definitely think creating awareness is very important, and it is something that should be more easily discussed.
And I love that we're getting, this conversation out there, because we actually have a caller on the line right now, Tanya from PE, that has a question for the doctor. So, Tanya, are you there?
Hi, morning.
Morning, Tanya.
Morning.
Hi, how are you guys?
Good.
Very good. What is your question for the doctor?
Good. So hi, Dr. Sonntag. I think for myself, I've been diagnosed with endo for the past 10 years, and I know that it's something that is misdiagnosed because a lot of the symptoms aren't common endo symptoms, for lack of a better way of putting it. So they're often referred symptoms. My symptom, I had a pain in my groin area for months on end, and I went from physio to GP to natural healthcare practitioners, and finally landed up at a chiro who said to me that his wife had a similar pain, and it turned out that she had fertility problems. And when I finally went to the endo specialist in Port Elizabeth, I was, after many months of trying to eliminate other things, diagnosed through laparoscopy with endo. So I just wanted to ask you if you could maybe just share to everyone out there what are the common non-endo-seeming related symptoms there are, like IBS, for example, right? That could also be a symptom.
Yes, definitely. So I think your story is a very important one because you have had struggling to diagnose the endometriosis for a long time and kind of missing the treatment. Some of the other causes that you can have are like IBS symptoms, bloating, abdominal discomfort, constipation, pain with going to the toilet, as I mentioned before, pain radiating down your legs, back pain. Those are all symptoms that you can have as well.
Brilliant. Well,
And
Tanya,
how, I just wanted to ask, I now have friends and family members who do suffer from similar symptoms, and it's not always endo, but I also feel like sometimes there's a block between having your GP recognize that maybe it's more than just, a surface symptom. How is it best then for ladies to get treatment beyond the GP?
I think to go and see a specialist. I think that you need to have enough trust in your GP that they will know that they're when to refer you. But I also think that if you find that you're not getting the help that you need and your symptoms are still continuing, then to go and see a gynecologist.
Awesome. Thank you so much.
Thank you.
Thank you, Tanya, for your call and your question this morning. I think it's so important that we do listen to our body. If you do have any of these signs and symptoms, then do definitely go and see a specialist. But Dr. Kim Sonntag will be here to answer more of your burning questions. So head on over to Expresso Morning Show, SABC3, if you do have any questions for the doctor.